My name's Andrew Oxenham. Most everyone calls me Ox. There's a few big roadblocks to having glasses as being a photographer. Glasses don't cover your whole field of vision. So one thing that's important for people who take pictures is to constantly be a student of the light around you. When you can't see your entire field of vision, you've got a whole bunch of space to your left and to your right, specifically your peripheral vision. You sort of learn to actually avoid those areas. Your eyes only look straight through the glasses. So the kind of light part of it is really difficult. Growing up, I definitely had frequent conversations about other eye procedures, but had a lot of skepticism about those procedures. But a lot of my skepticism came specifically from the fact that they're non-reversible. Some procedures are medically such that you can't go back and correct or course correct that. And so that was actually the biggest and the kind of main selling point for me on Vizient ICL. If at any point, if I wanted to, I could have them removed. But one of my favorite things about humor and about comedy is that jokes, at least linguistically, rely on the unexpected. So for this candy project specifically, I thought, what if we took candy and we put it in unexpected places? Sort of like a visual joke. You'd see it and you'd think, oh wait, that doesn't belong there. Haha, that's amusing in its own way. One of the things that made me feel pretty comfortable about getting Vizient ICL is the fact that it's actually been around for a lot longer, and that actually helped me see, oh good, it's a tried and true method, it's been around, people have actually done it, I'm not the first person in line sort of thing, and that gave me a lot of security about getting Vizient ICL. All the campaigns that I do end with me taking all those different ideas, whittling them down to the best one, attaching some sort of comedic bit, whether it's a caption or a visual pun in the photograph itself, and then posting it to my social media and letting my followers see what I've created. Thinking about life with glasses, my life had a whole bunch of tiny little hurdles, things that I jumped over, granted. But it was basically, I made my life conform to these constraints that I had. And now I've got Vizient ICL and I don't have to think twice about any of those things. I can grab my camera or grab my notebook and just run out and live my life unhindered.
The Vizient ICL is designed for the correction of moderate to high nearsightedness. Vizient ICL surgery is intended to safely and effectively correct nearsightedness between -3 diopters to -15 diopters, and partially correct nearsightedness to up to -20 diopters in eyes with up to 2.5 diopters of astigmatism. It is not intended to correct any astigmatism you may or may not have. If you have nearsightedness within these ranges, Vizient ICL surgery may improve your distance vision without eyeglasses or contact lenses. Because the Vizient ICL corrects for distance vision, it does not eliminate the need for reading glasses. You may require them at some point, even if you have never worn them before. Implantation of the Vizient ICL is a surgical procedure and as such carries potentially serious risks. Please discuss the risks with your eye care professional. Complications, although rare, may include need for additional surgical procedures, inflammation, loss of cells from the back surface of the cornea, increase in eye pressure, and cataracts. You should not have Vizient ICL surgery if your doctor determines that the shape of your eye is not an appropriate fit for the Vizient ICL, you are pregnant or nursing, you do not meet the minimum endothelial cell density for your age at the time of implantation as determined by your eye doctor, your vision is not stable as determined by your eye doctor. Before considering Vizient ICL surgery, you should have a complete eye examination and talk with your eye care professional about Vizient ICL surgery, especially the potential benefits, risks, and complications. You should discuss the time needed for healing after surgery. For additional information with potential benefits, risks, and complications, please visit discovervizienticl.com.